Today on World Medical Elites, we are hosting Dr. Len Schwartz, and he will be discussing how to secure 10 to 20 referral relationships with other successful doctors and specialists and receive an extra 100 to 200 new patients every year. Dr. Len is a former practicing chiropractor. He built one of the biggest practices in Philadelphia after just 3 years in practice. Dr. Len is a Fortune 500 trained business building and marketing strategist. And in 1999, he started a marketing company to help other doctors put organic marketing systems in place to add an extra 100 to 200 new patients every year. Welcome, Dr. Len.
Shirley, thank you so much. And, I think probably one of the more important things that you mentioned is the organic marketing system. As an organic marketing specialist, what that means is I don't pay, or at least I try not to pay for my marketing and new patients. And so today we're going to talk about a new patient generation system that is recession proof, requires no marketing, no prospecting, no paid advertising, no artificial intelligence, no social networking posts 10 times a day, no direct mail. Frankly, it requires none of the other traditional marketing efforts that many of the doctors that are watching and or their colleagues are likely using in order to secure a steady flow of new patients. And the best part about what I'm going to talk about today is that after you set it up, it will continue to generate at least 100 to 200 new patients for you, for all of you that are watching, passively for at least the next 5 to 10 years. And I think that's fairly conservative. Let me explain. In the mid-90s, when I was in practice, the medical community, the real doctors, did not really want to have too much to do with chiropractors. And dare I say it's gotten a little bit better, but it's not like they're terribly interested in working with chiropractors these days. But two things occurred to me way back then, early on in my practice, and that was the following. Number one, I knew that all of my patients were in the general practitioner's office, the family doctor's office, the orthopedist's office, the neurologist's office, the dentist's office, the dermatologist's office, etc. And the second realization was that I knew that 80% of Americans are walking around with some sort of neck or back pain, and it doesn't matter what doctor they're visiting, they're going to tell them about all their pain. And so what happened was I ended up finding 25 different doctors and specialists in my area that got to know, like, and trust me, and were open to referring to me. And once I initiated those referral relationships, I would receive referrals week after week, month after month, year after year. And because I made the referring doctors look like heroes for referring to me, the referrals did not stop. Now, this had such a profound impact on me that I started a company in 2004 called Pro Network. Pro Network became one of the largest, if not the largest, professional referral networks in North America. And I believe I've helped more doctors secure more referral relationships than any other person or company in the United States. And so I've been doing this for a while. I've got it down to an exact science. And so if the idea of acquiring an extra 100 to 200 new patients every year passively is of interest to you, all while building your name, your brand, your fame, and becoming the undisputed go-to recognized expert in your profession, in your region, where patients come to you pre-sold on becoming your new patient before they ever meet you. Today, I'm going to share with you what you should do and not do when initiating referral relationships with doctors and specialists, so you can start receiving referrals as soon as next week. And of course, a steady flow of an extra 10 to 20 new patients every month. And again, I'm going to say it again. What's waiting for you on the other side of these 10 to 20 referral relationships is easily an extra 100 to 200 new patients every year, passively, without any paid ads, any marketing, prospecting, chasing required. So let's dive in. Assuming you already have a stable of doctors to choose from, or you have doctors that are reaching out to you to establish referral relationships, or both, let me share some of these important do's and don'ts. The first don't: when meeting with a doctor, talking with another doctor specialist for the first time, never ask for referrals on that initial meeting or phone call. The point of the first meeting, and this is actually kind of the do, the point of the first meeting is for you to share information about yourself and to learn about the other doc. But when you share information about yourself, the idea is to communicate your value and how and why you are uniquely qualified, why you are better / different than all of your colleagues, all without bragging, by the way. And I'll give you an example in a second, so that you can give that other doctor an opportunity to know, like, and appreciate your value, your talent, your skills, your services, your treatments. Again, how and why you're better / different, because let's face it, everybody wants to work with the best. And so that's the point of the first meeting. You know, back in the 90s, when I started securing referral relationships, what I knew I could do was very quickly communicate how and why I was uniquely qualified. Just as an example, I had 3.5 years of postgraduate orthopedic certification. I was an American Red Cross back instructor. I was the chiropractor for the Junior Olympics, New Jersey State Junior Olympic swim team. I was already working with other doctors in hospitals around the area. I had been written up in the Philadelphia Inquirer. I mean, there were so many things that I could share about myself so that they knew I wasn't like every other chiropractor and they couldn't find anybody else like me. The other next don't is don't buy or bring anyone lunch. If a doctor says they'll meet with you as long as you bring lunch for the staff, he's out or she's out. You're not a pharmaceutical rep. And so ultimately, if somebody says they'll meet with you, but you need to bring lunch, that's a no-go. One of the next do's is I want you to make sure that when you do meet with a doc and you're leaving the office, you want to meet with his or her staff. Let's face it, it's the front desk person or front desk staff that will be responsible for facilitating the referral to you in your office. So meeting with them, endearing yourself to them, giving them a back office number and or names of your assistant, your front desk person, your receptionist, whoever it may be, so that they can make referring to you easy, or so that you can make referring to you easy, is absolutely one of the more important things that you can do when meeting with a doc for the first time in his or her office. Don't engage in a you scratch my back, I'll scratch yours relationship. What I mean is, if a doctor tries to suggest to you, hey, Joe, you refer to me and I'll refer back to you, that's a no-go. Because ultimately what you're looking for is a mutually beneficial referral relationship that you believe you can turn into a friendship. And I'll get to that part later and why it's crucial and important to you. So I don't want anybody suggesting that they're better or more important or more successful than you. And so that you scratch my back, I'll scratch yours is not going to work. In fact, I want to share just a quick story. I was young, probably 25, and I met with one of the biggest medical doctors in all of Philly, corner office, glass walls all around. I'm sure you can imagine it. And I probably looked 16 at the time. And he said to me, so I guess you're here because you want me to refer patients to you. And I calmly, and by the way, I did, I really want to do patients. But I calmly responded back. I forget what the doctor's name was, but I said, Doc, I'm not here for referrals. I'm here because I have so many patients now, and I don't currently work with a medical doctor like you. And so I thought it made sense to meet so that I can learn about you and whether I should refer my patients to you. Well, to say that he was shocked is an understatement. Again, I looked really young. I was new in practice. And here's the end of that story. He referred 3 to 5 new patients a month to me for the next 5 years. Let me share the next do. It's important when talking to your docs and specialists for you to share the opportunities that are available for you with them. What do I mean? Well, if you're, say, a dentist and you know that you have patients that come in with dermatological problems, or they have foot problems, so you need a podiatrist, or you have seniors who come in with hip problems, so you need an ortho. All of those things, whatever they may be for you, you want to volunteer when talking with that particular doctor or specialist, the types of patients that you have in your practice and why you need to refer to or work with somebody like them. When you start with that, the next thing you'll want to find out is whether they have patients that are fit for you and your practice, your treatments, your services, whatever it is that you do. Because ultimately, if they say, I don't ever have anybody in my practice that's looking for somebody like you or that needs somebody like you, well, that's a no-go. And that's fine. And all we're looking for is 10 to 20 referral relationships, because that's going to get you an extra 100 to 200 new patients per year. And again, we'll talk a little bit more about that in a couple of minutes. Here's the next don't. After you start or initiate that referral relationship and you have a good first phone call or a good first meeting or both, don't hound them, don't chase them and ask them where their referrals are. You don't want to appear desperate, and that's certainly not the best way to be able to start that referral relationship. Having said that, here's a do. Once you've established your referral relationship, you do want to nurture that relationship so you can turn that referral relationship into a friendship. I alluded to this earlier, and here's why. Friends refer to friends for life. And that's what you're looking for. You're looking for referrals for the rest of your practice life until you retire. Here's another do. After a doc refers somebody to you, once you have successfully treated them or whatever it is that you do, you've had a successful outcome with that patient, for whatever reason he or she came to you or was referred to you, you'll want to tag that doc who referred them back in to let them know about how happy that patient is about that successful outcome, because you want that doc and every doc that refers those patients to you to, again, feel like a hero in the mind of the patient for referring them to you, so that they keep doing it. Because if it feels good to refer people to you and that patient loves that doctor for having referred them to you, that's a feeling you want them to have over and over again, and they want to have that too. So when they have a patient that they can't treat, don't know how to treat, don't know who to send them to, and you become the logical choice, and they know that they're going to refer them to you and get a positive outcome, a positive result, referrals are seamless. Now, those are probably some of the more important do's and don'ts when initiating a referral relationship. And at this point, you may be asking yourself, what if I don't have 10 to 20 or more doctors referring to me? Well, if you don't already have doctors chasing you, reaching out to you to refer, or you don't already have 10 or 20 doctors in a stable referring to you every month, I can help. So I've got a program called How to Secure 10 to 20 Referral Relationships and Set Yourself Up to Receive 100 to 200 new patients every year. There are three really important parts to this program that I want to share with you. The first part is showing you how and why the most successful doctors and specialists in your area will reach out to you first in order to request having a conversation with you in order to discuss the possibility of establishing a referral relationship. Again, there is no chasing required on your part. You don't have to reach out to anybody. There are no gatekeepers to deal with. These doctors will be reaching out to you first in order to set up that first meeting. The second and equally as important part of the program is what happens after the doctor reaches out to you in order to have that first conversation or that first face-to-face meeting. You need to know how to communicate your value and how and why you are better/different than all of your colleagues, why you are uniquely qualified to help them, how and why your treatments or services or solutions, again, are better/different than all of your colleagues. Because what I'm going to teach you how to do, and these are really important phrases coming up, I'm going to teach you how to use that expert positioning in order to facilitate a rapid trust building process, which literally shifts the balance of power to you, which helps you start to reverse the chase. Now, by knowing how to reverse the chase, what I'm talking about is having a doctor that wants to engage in a referral relationship with you because he or she knows that by referring patients to you, you're going to make them look like a hero. And when you know how to dial in this communication and this dialogue, you're going to be able to easily set yourself up to secure that 10 to 20 or more referral relationships and receive that extra 100 to 200 new patients passively every year for as long as you're in practice. Now, the third part of the program is what you should do after you've secured that referral relationship and after they start referring patients to you. And that's what I call the nurturing and maximizing part of the referral relationship. As you might expect, your willingness to continue to turn these referral relationships into trusted friendships without being creepy or without it feeling weird will ensure your long-term success with all of the referral relationships that you secure. Frankly, I don't know of another effort that you can put in place that consistently and continuously brings pre-sold patients to your door, that also builds your name, brand, fame, and secures your status as the go-to recognized expert in your profession, in your area. Because again, when you have 10 to 20 or more people referring to you, you can't buy better word of mouth than having all of those patients who talk to their friends, their family members, their coworkers, or their neighbors about how their doctor referred them to you. And so when some of their friends, family members, coworkers, and neighbors come to see you, and of course, those are extra on top of the 100 to 200 new patients per year, they're going to tell their friends about doctors referring to you. And it just continues to snowball from there. Again, let's do some simple math. If you had just 15 docs referring to you, only 10 new patients per year, less than one a month, well, it's easy to do the math. That's 150 new patients per year. So if acquiring an extra 100 to 200 new patients passively every year is of interest to you, and you'd like to start talking to some of these doctors in your area next week, as mentioned, I've got that program, how to secure 10 to 20 referral relationships and set yourself up to receive 100 to 200 new patients per year. We're going to provide a link below. It's 3 payments of $19.97. I even offer a prepaid discount, and I have a 90-day money-back ROI guarantee. I've done this so many times with thousands of your colleagues since 2004. I've got it down to an exact step-by-step science. And again, if I'm doing my math right, you probably need 3 or 4, maybe a handful of new patients to pay for this entire program, which my average doc typically does within 30 to 45 days. Now, I'll volunteer. I get it. 3 common questions, and I'll share them with you now. The first question is, I refer out a lot, but I don't receive many referrals back. Well, when you learn how to set up and structure the referral relationship the right way, and I've shared some do's and don'ts with you today, and you're able to shift that balance of power to you, you're able to communicate your expert positioning, you're able to reverse the chase and turn that referral relationship into somebody who wants to and is willing to refer to you because of what he or she knows about you. I think you will find that these are all 2-way, mutually beneficial referral relationships. In fact, I would have my general practitioners, my family doctors, my specialists refer 10 new patients to me for every 1 I would refer back to them. And I wouldn't be surprised if that ratio was true for you as well. So this is 2-way in your favor, 2-way referrals in your favor. The next question, will I really receive 100 to 200 new patient referrals every year? I'm a big fan of managing expectations, and I can assure you I would not be using these numbers if it wasn't what I would want you to expect to receive as a result of this program and this effort. All I need you to do is use and implement the step-by-step process, secure those 10 to 20 referral relationships, and as long as you follow and use the system, yes, I am 100% sincere when I tell you that you can expect to receive an extra 100 to 200 new patients every year, and that does not include their referrals. Last question, how long is it going to take for me to establish and secure these referral relationships? You know, I've had some doctors secure 10 referral relationships in their first 2 weeks, and I've had other doctors take as long as 60 days to get those 10 to 20. It's really up to you, but ultimately, again, I've got that 90-day money-back ROI guarantee, so I fully expect you to have at least 10 to 20 strong, fruitful, viable referral relationships with the doctors and specialists of your choice within 90 days. And so, Shirley, those are the most common questions I get asked, and that's how the program works. And so I'm going to go ahead and throw it back to you.
Oh, that was such helpful information. I really appreciate the tips and telling us about your programs. Give me just a moment, and I'm going to go back and share your contact information. If you'd like to contact Dr. Len, go to Dr. Len at marketdominationsolutions.com. And to take advantage of his program, which we very much appreciate the special offer and the 90-day guarantee, go to pro2pronetwork.com/RR-docs. And the 2 is the number 2 if you're on a podcast. pro2pronetwork.com/RR-docs. This is Shirley Crest Dudley. Thank you for listening today. World Medical Elites is your best source for provider social proof. Remember to subscribe to our channel and to claim your listing at World Medical Elites.